All right, let's talk about something that, let's be honest, trips up so many people on the NCLEX, GI pharmacology. What we're going to do here is give you a sneak peek, a strategic preview from exam coaches on how to ditch the endless memorization and really start thinking like a nurse who's ready to pass. So let's dive right in.
Okay, let's get one thing straight right off the bat. The NCLEX, it doesn't really care if you've memorized every single brand name out there. Not at all. What it really cares about is, can you keep your patient safe? That's it. That is the whole game. And that's exactly where our focus needs to be.
And you know, the stakes here are incredibly high. Think about it. Missing one little sign of a GI bleed, overlooking one electrolyte imbalance, these aren't just small oopsies. On the NCLEX, these are seen as critical failures in judgment. And honestly, they can be the thing that stands between you passing and you failing.
So we need to be crystal clear about the mindset shift that has to happen. The NCLEX is not a test of your memory. It's a test of your judgment. It's all about, can you spot the risk? Do you understand the consequences? And can you take the right action right now?
Okay, so that brings us right to the heart of the problem, the core challenge with GI Pharm. There's a really good reason why this topic trips up so many candidates.
So let's just ask the question head on, because I'm willing to bet you felt this yourself. Why in the world is this topic so overwhelming when you're trying to study for the boards?
Well, it usually comes down to these really common traps. You're trying to just brute force memorize the differences between antacids, H2 blockers, and PPIs. Or maybe you're overlooking those crucial monitoring parameters for kidney function or electrolyte levels. And this is a big one. You get so focused on treating a symptom, like heartburn, that you completely miss the signs of a life-threatening complication.
So here's the takeaway, the really crucial point. Success on the NCLEX isn't about knowing more stuff. It's about thinking better. The exam rewards your ability to see that straight line connecting a medication, a potential risk to your patient, and the absolute correct nursing action. And that, right there, is why having a framework is your most powerful tool. It's a game changer. So let's take a look at how we at Exam Coaches organize all this chaos, starting with the acid-controlling meds. Okay, now take a look at this. I know it's a bit small on the screen, but you can see the idea, right? This is not just a list of drugs. It's a mind map. It's a framework that organizes these meds by what they do and why we use them. This is the whole key, moving away from just random facts and building a logical structure. It's how you start seeing the connections, the relationships, instead of just trying to memorize a bunch of names. And this table, it just brilliantly shows you the power of that kind of structure. I mean, look how clear this becomes. Antacids neutralize acid. H2 blockers suppress secretion. PPIs suppress production. But here's the really important part. Look at that key monitoring alert column. That is where NCLEX questions live. Drug interactions for antacids, confusion in older adults for H2 blockers, timing it right before meals for PPIs. This is clinical judgment right there at a glance. See, this is exactly what a good framework does for you. It elevates your thinking from just symptoms to actual dangers. You stop thinking about, heartburn, and you start actively scanning for red flags. You're looking for a potential GI bleed. You're looking for signs of renal compromise. These are the critical safety priorities that NCLEX is designed to test. Okay, so let's do a quick gut check right here. Your patient reports epigastric pain and melena, those dark, tarry stools that just scream GI bleed. What is your first priority? And notice the question. It isn't what drug do you give, it's what is your priority action. That, my friends, is the NCLEX difference.
All right, let's keep this momentum going and move to our next section. We're going to apply that exact same priority-focused thinking to managing bowel function. We'll be looking at things like IBS and the medications we use for it.
And you'll see the framework handles different symptoms with the exact same safety logic. So for constipation, we might use bulk-forming agents. Simple enough. But for diarrhea, we might use a drug like alosetron. And that one comes with a huge flashing red flag, the risk of ischemic colitis, where blood flow to the colon gets dangerously cut off. The NCLEX absolutely expects you to know that life-threatening monitoring priority.
And again, what are we doing? We are always thinking about the worst-case scenario. With any patient who's got severe diarrhea or constipation, your mental red flag alerts should be going off for dehydration, electrolyte imbalances, and the potential for life-threatening bowel obstruction.
So let's test that out. You've got a patient with IBS. They have severe diarrhea and cramping. What is your priority nursing intervention? Is it just giving them a med? Is it getting them something to eat? Or is it assessing for something way more dangerous? Okay, one more for you. A patient is taking a laxative, and now they've developed abdominal cramping and nausea. What do you absolutely, positively have to check first before you do anything else? See? It's all about spotting those complications early. So what have we really been doing here? We've looked at acid control, we've touched on IBS, we've talked about laxatives, and yeah, they might seem like totally separate topics, but the exam coach's approach connects all of them into one unified system for clinical reasoning.
And here it is. This is kind of the aha moment. This is the single unifying principle that cuts across all of GI pharmacology. It's actually pretty simple. You anticipate complications, you monitor for them safely, and you always prioritize the most critical intervention first. That's the system. That's the whole thing.
You know, this is exactly what we mean when we talk about training for the NCLEX. It's not about just handing you a bunch of lists to memorize. It's about building a solid system for clinical judgment. So here's the exam coach's advantage. Let's just break it down. 1, we train you to recognize the red flags and the potential complications before they turn into a full-blown crisis. 2, we train you to prioritize which nursing action is the most important one to take right now. And 3, we put all of that together to build true NCLEX-level pharmacology judgment. And please remember this, because it is the absolute truth of this exam. On the NCLEX, the safest and most timely action you can take is always, without a doubt, the highest scoring answer. Our entire approach is built from the ground up to get you to that answer, every single time. So what you've seen here today, this was just a preview. It's a taste of how we transform GI pharmacology from a frustrating list of facts into a powerful system for judgment. The full, complete, high-yield framework, well, that's waiting for you inside the exam coach's platform. Now go get it.